Okay, also, I'm going to talk about articulations of the ribs with the vertebral column and other articulations that go on as well. But I want to show you one thing on this spinal column here. So we have talked about the occipital bone connecting to the cervical region, thoracic region, lumbar region down here. And you'll notice there's this little jelly bean sticking out the side here. And that's supposed to represent a herniated disc sticking out. So the nucleus pulposus sticking out here. And it would be pressing on the spinal nerve here. And so that could cause some pain if it was compressing that nerve quite a bit. So anyway, so we got models that show all kinds of cool stuff. So here's your sacrum. Sacrum is here. So you have the L5 vertebrae sits on top of the sacrum here, and you have the superior articular facets here, and the lumbar vertebrae sitting there on top of them. And then you have nerves coming out of the sacral foramina there, and then you have the coccyx way down there at the bottom. So, and here's your SI joint here and here. So that's the SI joint. So the sacral iliac joint, iliac joint. And yes, I did misspell that earlier. It is the ILIAC joint, not the ILEUM. So I'm going to flip it back around. Sorry, I know that's really jerky and kind of hard to follow. Here is the pelvis. Okay, so here's left side, right side, and they come together at the pubic symphysis. So they're going to fit together like that. And then if I can hold them together, then you're going to have the sacrum, and there's the auricular surface of the sacrum on the sides. Okay, so it is going to fit in right like that. So I can't hold all this stuff and fit them all together, but you get the idea. That's where it fits in. Okay, so and then here's the talk about the manubrium, body of the sternum, and then the xiphoid process sticking down here. And so here's your costal cartilages coming off the sides here. So ribs 1, 2, 3, 4, 5, 6, and 7. They all have their own costal cartilage. 8, 9, and 10 attached to the costal cartilage of 7. And then 11 and 12 are just floating back here. And I'll show you those on Napoleon over here in a second. So, and then here's your sternal angle is right here. So you can see that's where the body of the manubrium and the body of the sternum come together. And that's right at rib number 2. That's where that sternal angle occurs. And here's your suprasternal notch. And then here's where your collarbones, your clavicles are going to touch right there on the top of the manubrium. So so right there, it's manubrium here. It's going to come in right there and touch on either side there. So you have a clavicle and another one coming in there. And let's see. And then you have a rib. So here's the rib. So it's going to have it's the left one. So it's going to come in. It's going to touch this cartilage. Okay. So this costal cartilage end of the rib is going to touch there, and then the part that has a tubercle on it, has this little bump on it. This is going to go back. This is going to touch the transverse process of a thoracic vertebra, and then the end here has 2 facets on it. You can't really see it in the video, but you can actually feel them. And there's 2 little facets on here. So there'll be a superior and inferior facet on the head of the rib that fits into. It's going to fit into the thoracic vertebra, and I have a thoracic vertebra here. So this is the left side. So let's say I'll fit on this side. So here's your transverse process. Here's a better one. So it has a better transverse process on it. So we're going to have the rib is in here posteriorly. This is the anterior part. So it's going to fit in, and it's going to come in, and that transverse process is going to hit the tubercle rib, and then the inferior facet of the head of the rib is going to fit into, is going to hit the superior demifacet on this this particular rib, on this particular vertebra. So if I have two vertebrae together, then you can see it come in. It's going to hit the tubercle rib. It's going to hit there, and this is going to fit in, kind of like that. That's how it's going to fit. So, and then I'll take the camera over and just show you where those ribs articulate on here. So you can see on the back side here, you see all these articulations where the rib comes in, tubercle rib hits the transverse process there, and then continues on into and touches, if I can get my fingers in there, touches the body of the vertebra there. And you can see all those going down like that. So that's all the ribs come in here and touch. And here are your floating ribs here, 11 and 12 on both sides. They don't have any cartilage on them. They don't come up and touch the sternum at all. And also, there's also this opening here, up here, and there's another opening here. These are called thoracic outlets, or this is called or thoracic inlet. And so you can have, if you have compression of the nerves and blood vessels, stuff that come out of the thoracic outlet, coming out like that, okay, of the stuff that comes out of here like that, then that can be called thoracic outlet or thoracic inlet syndrome. Is talking about it. So if you've ever heard of thoracic inlet syndrome, that's what that is. It's an effect that affects the portion up here above the collarbones, so above the ribs and collarbone. And so I believe that's it for this section. Yay! Bye.